well, topography of kidney, topography. That is 11th thoracic vertebra. Here it is 12th thoracic vertebra. First lumbar, second lumbar, and third lumbar. T11, L3. It is left kidney and superior and extremitas superior of left kidney is at the level of middle part of T11, and inferior and extremitas inferior at the level of superior border of L3. 12th rib, 12th rib, 12th rib. It's across left kidney in the middle part, in the middle. On the right side, inferior border is superior and extremitas superior of kidney is below than on the left side. Why? Because it is on the right side we have liver. That is why a right kidney is if it is middle part of T11, this is inferior border of T11. Sometimes that is iliac bone, os ilium, iliac bone. Here it is sacral bone, and sometimes inferior border of kidneys. It is more frequently in female than in male. Is at the level of iliac crest. Iliac crest. Holotopy. If you remember topography lines on anterior abdominal wall, superior, inferior, and this is right kidney is in epigastric region, in right lateral abdominal region, and umbilical region on the right side. On the left side, we speak only about epigastric and no, in my diagram it also comes to umbilical, but we speak about epigastric and left lateral abdominal region. Now, internal structure of kidney. That is kidney, and I already said that it has extremitas superior, inferior, middle border and lateral border, and two surfaces, anterior surface and posterior surface. If we cut kidney, we can see that kidney has cortex and medulla. Cortex, here it is cortex, near or 5 millimeters, that is thickness of cortex on peripheral side of kidney, and medulla, it consists of pyramids, and base of pyramids it looks to the surface of kidney, and apex goes to hilum renalis. This may be from 7 to 13 pyramids in kidney, oh, I draw some of them. They are pyramids, and cortex, tissue of cortex. It's insert in space between pyramids, and we speak about columna renalis. Columna renalis, that is places where cortex of pyramid continues in space between nearest pyramids. That is part of the cortex which is opposite to columna renalis, this part of the cortex, that is pars convoluta, and parts of the cortex which is opposite to pyramid, that is pars radiata. That is why in cortex we have pars radiata and pars convoluta. One again, pars radiata and pars convoluta. And in medulla we have pyramid and columna renalis, and lobe of the kidney, that is one pyramid and nearest part of cortex, that is pyramid of the kidney. That is why number of lobes, number of lobes is the same
30.
number.
Pyramids.
Yes, how many pyramids? The same number of lobes. Because one lobe is one pyramid together with nearest cortex. What else? This is hilum renalis, and hilum renalis continues into the tissue of cortex and makes this is sinus renalis. And in sinus we have lesser calyces, which an apex of each pyramid opens into lesser calyces, calyces renalis minoris. And lesser calyces join together and makes greater calyces, and greater calyces joined and makes pelvis. It is this pelvis renalis, and pelvis renalis then continues into ureter. Ureter. Then. What else? In hilum renalis, except ureter, we have also renal artery, arteria renalis, and renal vein. And vein, if I cut it in horizontal level, this is kidney. How to? Okay. Anterior position in hilum renalis, anteriorly, that is vein. A middle position, that is artery. And posteriorly we have ureter. Vowel, V, that is vein, then artery and ureter. That is in hilum renalis. In hilum renalis, anteriorly vein, posteriorly ureter. Between them, artery. And artery, that is renal artery, arteria renalis, it comes to kidney and subdivides into three branches. Arteria polaris superior, arteria polaris inferior, and arteria centralis. And each of these artery continues to divide, it continues into arteria interlobaris, interlobar arteries. I draw another diagram. This is